Hello guys, so welcome to this DNB mock test paper analysis. So it is from our app DNB Medicine Notes and OSCE app. So this is first of a kind. Previous session also have organized this mock test, only platform to do it in India. Online, direct open camera based mock test examination from which question paper are also analyzed. Okay, so this is first time we are doing from our own system through our own application process and online proctoring system, right? So first of all, why this thing called mock test is important for you, right? So it helps you only to brush up your skill of writing and reciprocating what your client told it in last 3 years of your journey as a resident into 5 page answer sheet, right? So thing is that you may know lot of things about a particular disease, or some disease may be completely unknown to you, which can be asked in the question paper. Some question can be very hard, some question can be very easy, right? But how to approach is the thing that examiner want to see, and based on this, they evaluate you and give you marks. You need to summarize everything from it in total in 5 pages. In some cases, you might know a lot of things about the disease, so it is very hard to summarize. And some cases, you may not know anything about it, and if it's very hard to read even a single page about the condition, right? So at this point, you should know how to go structured approach. Even if you don't know how to write about how to go forward, how to manage at least ABC or everything circulation, how to investigate a case, this approach is required from you. So this mock test is to help you. This mock test is only to help you so that before the final exam, you get a trial run. So how the writing practice, which has been lost for many years. So you guys were practicing MCQ like 3 to 4 years back, and there was experience of practicing MCQ only. For last 3 years, you were working at wards or in OPDs or in ICUs. At this meantime, writing paper habit has completely gone. I can assume most of you are currently in the zone who are writing in very shortened format, say writing OD, PD for once a day, twice a day, which is not usually advised to write in exam paper. You might be writing brand names of medication instead of generic name because of the habit. And also you might have habit of writing in very short, or your use your own symbols for identification in the case sheet or case note. So this thing is not going to help in exam, right? So you may write something like AKI grade 3, or increasing trend of creatinine in the case sheet. What happens in exam is that you also start writing in the similar trend, similar pattern what you are experiencing currently in the case sheet. So it's always better to experience completely writing creatinine instead of case here. Writing complete dose of medication. Say instead of writing the brand name, start writing in the case sheet as injection meropenem IV 3 times a day. 3 times a day. Instead of TDS, start writing, or you may write like this in the case sheet, making symbols. Start writing 3 times a day over 1 hour. So complete writing habit will help you in writing an exam. Okay. Second thing, as you can see, the proctoring session is already ongoing. So a lot of students has already joined the exam, and it is live monitoring dashboard. It is ongoing. So whenever you find the question paper, so this is our mock test question paper. When you find the question paper, your first step is to make your mind calm. Real-time exam can be very difficult to. Difficulty is subjective, but it can be hard, medium, or very easy. Sometimes question paper can be lengthy, or question paper can be short too. So how to approach in such cases? Remember, there are in total of 10 questions. 10 questions. 2 questions each is checked by same examiner. Okay, so 2 question set is checked by same examiner. Sometimes what happens while managing the 3 hours time, that is 180 minutes, we often spend most of the time solving or writing the initial set of questions, say initial 4 to 5 questions. So you don't have enough time to provide for last 2 to 4 questions. Okay, So what happens there that you write short, you write less, and marks you get on those questions becomes less, and your chance of passing in the exam decreases in these last 2 to 4 questions. So one approach you can always adhere to is to, instead of writing serially like 1, 2, 3, 4, going from one question number 1 to question number 2 to question number 3, you can always start with question number 1, then question number 3, question number 5, question number 7, question number 9. Remember, the first impression is the best impression that you can build. So whoever the examiner is checking, if you write say question number 7 first, for this person it is the first paper, right? This person examiner is checking question number 7 and 8 together. So if you give enough time to question number 7, if you give enough time to question number 9, that is the first question of your paper that examiner is checking. So chance of having good impression for your next question, that is question number 2, 4, 6, 8, 10 increases. Okay. So this is one approach. Another approach is the start with the questions which answers you know very well. So you get chance to increase your marks in those question, and obviously look at the time. So timer will be there in the upright corner, So in the upright corner, a timer zone will be available. So whenever you are giving examination, there will be upright zone which will shows the time, how much time is remaining. Okay. So in this zone, what you need to do is that check for the time. Say 180 minute is there. Spend initial 20 minutes before writing a single word on the answer sheet. Spend initial 20 minutes thinking about how will you structure the question. Let's see by example. So let's open the question of the mock paper today. Mock paper. So what are the questions? Describe the Dallas criteria for the diagnosis of viral myocarditis. So it is 2 mark. Discuss the scoring used in the diagnosis of leptospirosis. It is again 3 marks. Outline the approach to the management of mucormycosis in treatment defaulter patient with multi-drug resistant TB. It is again 3 mark. Okay. So how are you going to structure it? So in this 10 marks, how many pages you have? You have 5 pages. Okay. So each page bears around 2 mark. So to write Dallas criteria, you can spend, because it is 2 mark, 1 page. For leptospira scoring, it is 3 mark. You need to spend 1.5 page. And approach to management of mucormycosis. So it is 2 questions clubbed together. Approach to management of mucormycosis. In treatment of defaulter patient with multi-drug resistant TB. It is 5 marks, so you can spend up to 2.5 pages. Okay, is it clear? So you know how much amount of pages you need to spend for this question. Now what does the examiner wants from you? Examiner do not have enough time to read through your complete answer sheet. Try to incorporate flow chart wherever you can. Okay, so what are the scoring pattern? So first of all, one important point you need to write about Dallas criteria is that it is nothing but not a clinical criteria, it is a histopathological criteria. All right, you need to mention this part at least. You need to mention this part here. Then obviously there are points regarding like active myocarditis present or not, borderline myocarditis present or not, and what are the limitations of the test. So whenever you are writing any criteria, try to incorporate any limitation present or not, then any recent ability related to it present or not. If you know, it's okay. If you don't know, it's all right. So criteria is there for active myocarditis, as well as borderline myocarditis. What are the points you need to write? You need to write that endomyocardial biopsy is required. Biopsy is required for making the diagnosis, and it is associated with myocyte necrosis, is degeneration. Sometimes inflammatory infiltrate can be present there. Now, what are the issues pertaining to it? Issues pertaining to it that there is limitation with sampling error, because it's a biopsy-based diagnosis, so sampling error will be its limitation. Then specificity is high, but sensitivity is very low. Sensitivity is low. Okay. So these are the limitations that you need to mention. And what are recent update apart from the biopsy? What are used in current time immunohistochemistry in the biopsy along with the PCR based diagnosis are also used for diagnosis of viral myocarditis. Okay, so these are the recent update you need to mention to get complete 2 marks in the last criteria. Now regarding leptospirosis scoring, so if look here in first question Dallas criteria was mentioned. Okay, so mentioning Dallas criteria again will not fetch mark. What will fetch you mark if you mention that it is a histopathological criteria? Now what is the name of the scoring system of leptospirosis? Name of the scoring system is modified Fain score. So if you just name it, it is already giving you half to 1 mark. Okay, so you know the name. Now, how is this score divided? If you know it's okay, if you do not, so obviously you write something here. So thing is that there are some point parting to it. So what is the point? It is 3 parts in modified Fain criteria. There are part A, part B. So look, here you can easily divide into flowchart. Okay, so part A, part B, part C. Part A are clinical features. Part B include epidemiological point, and part C means lab criteria. So what are the lab criteria? Lab criteria for leptospirosis diagnosis is IgM ELISA, microscopic agglutination test, or PCR. And part B are epidemiological factors like rainfall, exposure to flood, animal exposure, or occupational risks. Clinical features like fever, headache, myalgia, conjunctival suppression, meningism, and jaundice are included in it. Okay. Now, again, it is not ending off here. To get complete 3 marks, so what are the point you need to write? You need to write about modified Fain score, you need to write about part A, part B, part C, all 3 points. After that, mention the interpretation. Interpretation is that if the scoring of part A plus part B is more than 26, more than or equal to 26, so A plus B more than or equal to 26, it is the presumptive diagnosis. So based on presumptive diagnosis, we go for part C, that is the lab criteria, that is IgM, ELISA, MET, and PCR. And based on this, if it is A plus B plus C is coming, particularly more than 25, in such case with inclusion of C also, it is confirmation of the diagnosis. Okay, so that's how you write the structure of the question so that you get complete mark 3 out of 3 here in modified Fain score question. Now coming to the next question of this first part. This first part was regarding, so here you can see next question was regarding the outline the approach to the management of mucormycosis in treatment defaulter patient with multi-drug resistant TB. So it is a clinical linked question. Okay, clinically linked question. So what the examiner wants here. So first of all, this is about mucormycosis management. So whenever there is a term management, you need to write about diagnosis and treatment both. Don't forget this part. And treatment, always write about A, B, C, D. Yeah, breathing circularity and disability limitation. Then start with the specific management. At least spend few words, few lines regarding this. Okay. Now, diagnosis of mucormycosis, it is a fungus. So how will you approach? Obviously, you need to confirm the diagnosis by mount. What mount? KOH mount. What else we can go for? We can go for histopathological analysis. You can go for, obviously, to check for how much mucormycosis is involved. So to check for extension, so it is orbital or rhinocerebral mucormycosis. You can obviously check for extension through MRI or CT scan. Okay. Now, how to manage? So in management of mucormycosis, important point is that you need to control the predisposing factor. So what are the predisposing factor? It can be tuberculosis itself, as in mentioned in the question. So it can be DKA or diabetic ketoacidosis. It can be steroid excessive use, or you can obviously provide nutritional support to the patient at this point so that predisposing factors are controlled. What is the therapy? Therapy is obviously antifungal therapy. So drug of choice will be your liposomal amphotericin B. Specific treatment is liposomal amphotericin B. So liposomal amphotericin B. So you give around the dose. If you can write the dose, it is better. And whenever writing the dose, don't just write like 200 milligram or 400 milligram like that. Write it based on weight. So 5 to 10 milligram per kg per day is the dosage. Okay. So based on weight, this is the another factor that you should know while writing in question. Then obviously, if medical management fails, what is the next step? Write about the surgical management. Don't forget to write the extra point regarding those cases where medical management failed. You need obviously to go for surgical management. Okay, so aggressive debridement and repeat procedure if needed is required in case of mucormycosis. Right now, one of the issue with this particular question is that you can see it is not only about management of mucormycosis. So management of mucormycosis is not going to fetch a complete point. You need to write about MDR TB patient, and this patient is also treatment default. So how do you approach this case? Okay, so patient is MDR TB with treatment default. So what is the important thing? MDR TB. So how do you approach a case of MDR TB? We need to repeat CBNet. Repeat CBNet. At the meantime, check for drug sensitivity testing and culture and line probe assay. Okay, and obviously because if the patient is treatment defaulter, you need to restart MDR therapy. So what is the current MDR therapy preferred? It is B-PALM regime. Okay, betaquilin based regime. Now, important interaction that you need to write here, because in this question it has been mentioned. So what is the side effect of B-PALM regime and what are the side effects of the antifungal that you are going to give? Okay, so that is the point where examiner wants to know how to monitor these cases. So remember, betaquilin is the one which causes Q2 prolongation. Among antifungal, it is the posaconazole, which is used in stop-down therapy. In mucormycosis, it can result into Q2 prolongation too. So monitoring here is ECG changes. Okay, so ECG changes, ECG based monitoring, baseline ECG monitoring should be there. Okay, and obviously ask for follow-up, check for renal function status, imaging status for mucormycosis, what is the status currently, and check for the clinical response. All right. Okay, all of those things should be mentioned in your exam paper. Okay, now now let's look into how people are responding currently. So there it is live exam is currently ongoing and I'm streaming it live for you all. So they cannot see that I'm seeing them and they are doing their exam. So as you can see here, so people are still writing, they're live. So camera is updating itself. So let's just go into approach of the second question. So what I want from you is that, so from this 10 question, spend initial 30 to 20 minutes of thinking in short. So how to going to approach in a particular question? Okay, so when you know you need to approach a particular question, say discuss the management of neuroparalytic snake envenomation and write a short note of hantavirus cardiopulmonary syndrome. So it is 5 marks. So you need to spend two and a half pages for all. What you can do is that in half page, you write about the flowchart at the very end and highlight important point regarding the flowchart. Flowchart should contain everything regarding the management approach, what you feel. Okay. Okay. Then let's just discuss about this question. So how do you can approach this last question here? So here, what are we going? We're going to discuss about neuroparalytic snake envenomation and hantavirus cardiopulmonary syndrome. Okay, so these things are very new, not touched previously. You may know about, read about neuroparalytic sneak elimination, but hantavirus question is very new. It was never asked previously. So it will be obviously supposedly difficult for you. But from the question itself, you know, it is about cardiopulmonary syndrome. Okay. Okay. So how to approach this cardiopulmonary syndrome? So in such cases, and what do you know about hantavirus? It is obviously infective cause. So you need to write about infectious causes. What is the agent? Write about symptom. Symptom will be cardiac symptom and pulmonary syndrome. Cardiac symptom and pulmonary syndrome. It is the only case when you don't know anything of the disease, write about likewise. And it is a short note, so you can write anything, right? So symptom. So how to approach the case? So you know symptoms are cardiac and pulmonary. So approach always start from history, then write physical examination. Physical examination, you can write in short what you are going to monitor. You can need to monitor about CBS finding as well as respiratory finding, auscultation and inspection science. CBS you need to select for GBP, murmurs or additional sound. Okay. Now how do you investigate? Investigate first with chest X-ray, if required, HRCT thorax. For cardiac imaging, you can go for 2D echo. For specific causes, you can obviously go for NT-proBNP. Okay. Now, how do you manage specifically? If you know something, it is good, but otherwise, write in general management. In general management of these cases. Okay. So, so regarding this, what you need to add more is that because it is infectious agent, symptom will have plus minus. There can be fever like symptom. Okay. Fever like symptom, there can be myalgia, headache, nausea, vomiting like symptom in such patient. Then you need to add additional points. So is it the usual infection, so if you have read about current affairs or thing that it is a rodent borne, you might know it is a rodent borne disease. So reservoir are rodents, and one of the important feature of this disease is capillary leak syndrome. Capillary leak syndrome. So all the feature of capillary leak syndrome will be there. So patient will present pulmonary symptom in the form of pulmonary edema and cardiac in the form of shock. Okay. So that can be the usual presentation here. Is there any specific therapy? There is no specific therapy. How to manage? You are going to manage it conservatively. You are going to manage in the form of conservative therapy. So what you're going to write in conservative therapy? Again, as it is an unknown question, perhaps you have not read in the exam. For exam, start with A, B, C, D. Yeah, your breathing, circulation, and disability limitation. So how do you approach in conservative approach? Do you admit the patient or treat in OPT basis? Obviously, it is cardiopulmonary syndrome ongoing. There is a shock. There is obviously pulmonary embolism might be there. So you need to admit in ICU. You need to monitor according to ICU care. Okay. So that's the usual point that you need to try it in exam, even if you don't know, at least so that you can gather some points, at least 3 to 4 out of 5 in such questions. Okay. All right. So let's just see how everyone is doing currently. So as you can see here, so live image feeding is ongoing. People are live trying to write the exam. So whenever the exam is ongoing, so you can see here, this is the first time we are monitoring such platform. So as you can see here, everyone is preparing for the exam. So as you can see here, we are monitoring currently, ongoing monitoring system. So it is a live exam monitoring dashboard, first of a kind. Such thing has been devised for the help of the and benefit of the student. We are also monitoring what is the event, how many times screen has been closed, how many times screen has been tapped, so that it gives a real-time experience for you all. Okay. So thank you all. Best of luck for your exam. Hope even if this paper seems tougher for you, this mock test seems tougher for you, real exam seems fine for you all, fine for you all, and you as each and every one of you is very well in your final exam.